Hi, my name is Paula, and this is an instructional video on how to perform passive range of motion on the shoulder and elbow on a patient in supine position. You would perform passive range of motion on a patient when they don't have active range of motion. Passive range of motion can also help prevent joint contractures and can help maintain flexibility in a joint. So the role of the patient in passive range of motion is for them to be able to tell you if they are experiencing any kind of pain or discomfort when the therapist is actually performing the movement. If the patient does have pain, you would discontinue that movement. So the role of the therapist would be to move the patient's extremities through the range of motion in a slow, gentle way and to stabilize the joint. Also, the therapist needs to be observant on how the patient responds to the treatment. Patients may not always verbalize their pain or discomfort, so the therapist would want to be aware of any signs that they are having any pain or discomfort. So we have Ashley here as my patient, and I'm going to perform passive range of motion on the shoulder. So what you want to do is take your hand and you want to put it under the scapula, and then I'm going to go ahead and we're going to do shoulder flexion. So you're going to grab down by the wrist kind of, and we're going to bring in a slow, gentle way. We're going to go over as far as the patient can go. And while performing passive range of motion, you want to ask the patient if they're in any pain. So are you having any pain?
Nope.
Okay, so then we're going to come back down. This is extension here, shoulder extension. Now we're going to go ahead and do abduction. So we're going to go ahead once again. You want to keep your hand placed under the scapula, and we're going to bring it out as far as they can go. So you want to, this is going to be abduction, shoulder abduction. Bring it out. Are you in any pain?
No.
Okay. Then we're going to go ahead, and that is adduction, bringing it back. So now we're going to go ahead and we're going to do internal and external rotation. So we're going to want to bring the patient out and have a 90-degree here angle. Go ahead and place your hand again under the scapula. And then for internal rotation of the shoulder, you're going to bring the patient's hand down with palm facing the floor. And now we're going to bring it up and have the palm facing the ceiling. Okay, how does that feel?
Good stretch.
Okay, so, and those are the movements of the shoulder. So now we're going to do a couple of movements on the elbow. So we're going to go ahead, and you want to place your hand. You want to again stabilize the joint, so we're going to go right above the elbow. And I'm going to have the patient bring her hand up with her fingertips towards her shoulder. And this is going to be elbow flexion. Okay, and bring it back down. That's elbow extension. All right, and now we're going to do supination and pronation. So what you want to do is again have them bring their hand up. Then you want to grab their wrist, and if you turn the wrist up where the palm is facing towards me, that would be supination. And then when you turn it around, that's pronation. And those are the movements of the elbow. And that is how you perform passive range of motion of the shoulder joint and the elbow joint of somebody in supine position.